So just quickly, in today's agenda, we're going to talk very briefly on the overview and objective of the project, and then Connie and Karen can walk us through some of the contracting pieces. And then finally, we'll also touch upon some programmatic details, some scope of work things, just to get things rolling in terms of getting a medication delivery service put in place at OTPs. And then we'll also have time for a question and answer. So again, feel free to pop all your questions in the chat box and the Q&A, and we'll get to them. So let me just share my screen real quick. All right, so in terms of an overview of an objective of our current initiative, I'm sure a lot of you are aware of that we have a New York City medication delivery system, the MDS, that was created in light of COVID. It started in April 2020, and it is still currently ongoing to a certain extent. It was a collaboration between OASAS, New York City, DOHMH, and also COMPA. And like I said, it is still ongoing. We recognize that there is a continued need with the rising COVID cases, as well as just ongoing need for a delivery service. So with that being said, the current initiative is a redesign of MDS, redesign of the city system. However, it includes the entire state. All New York State OTPs are included in this initiative. So with this initiative, all New York State non-proprietary, so not-for-profit OTPs will be funded to develop strategies to provide medication delivery for eligible patients. And I will go into the point of eligible patients in need later, but just a brief overview. This funding has to be expended on or before March 14, 2023. So I'm going to pass this over right now to Connie to just talk over some of the contracting details.
Great. So as you now know, so the funding that we have through SAMHSA, the SAPT Supplemental 1 award, are the dollars that we're able to access to support the medication delivery system. And those dollars are made available for a 2-year period. So we had gotten the funding in March of 2021. The dollars are available to us through March 14th, 2023. So know that the dollars that we're providing do reflect, I believe, a 12-month budget, and know that we are operating within the constraints of a limited time frame in terms of the available use of dollars. So because the dollars are coming through SAPT, these grant funds are managed through the state. So some of you may be familiar and have had discretionary grants previously where you worked with RFMH. They act as our fiscal agent, and you would have had a contract with RFMH to support the specific project or the effort. In this instance, because the dollars are flowing through the state agency, you will have a direct contract with OASAS to access these dollars. Now, most of you, if not all of you, have hopefully taken advantage of opportunities for funding under SAPT through other initiatives, like through the Workforce Initiative or the Stabilization Initiative. Hopefully you have, and with that being the case, what we're going to do in this instance, because there is a dollar amount that's being directly awarded to you as a provider, we are going to amend those existing contracts under SAPT to add the amount that's available to you for the medication delivery system. That way we won't have a new contract for every single effort or initiative that you participate in. So in communicating this information and letting providers know what they needed to do, we did send out an email blast last week. And actually, Celine, if you could give me permission to share my screen, I'd like to show people the email that was sent out on Thursday of last week, right? And that email, which you can see on my screen and your screen, hopefully. As you can see, the email was addressed at the provider level. We did send the email to your primary contact as listed in the provider directory system, or if you had notified us of an alternate contact specifically for SAPT supplemental funding contract communication, we would have listed that contact person here. But you would have received an email this past Thursday. Was it Thursday or Friday, Celine? It may have been Friday morning that we sent it out.
It was Friday.
Okay, so Friday, the email was sent. We identified for each provider the dollar amount that they were eligible for. Know that the allocation was for dollars was based on programs. So if you're a provider who manages or runs more than one OTP program, those dollars reflect multiple PRUs. But the letter would have indicated the dollar amount that you're eligible for and where you can find additional information about the opportunity. So we do have a hyperlink here to the Supplemental Funding Opportunity webpage, which I'm going to show you in a moment. And I also want to make a point of making sure folks are aware that in order to execute a contract with OASAS, there are certain pieces of verification that we need to go through. You do need to have, as it states in the email, a federal employer ID number. You do need to be registered in Grants Gateway and have an SFS supplier ID number. In addition, it's very important that you've completed a vendor responsibility questionnaire within the last 6 months. You could have done this electronically online, or you could have done this on paper, and there would be verification that you could provide to us with that information. So know that with regard to that particular paragraph, there's a lot of really important information there, because without all of those things taken care of, we won't be able to execute the contract, and we don't want to create a delay there. Know that there is information with regard to every aspect of the contracting that you need to complete available on our website, in addition to those hyperlinks that are in that email address. So in terms of what we have asked for folks to do in order to affirm that they are interested and wanting to accept the dollars for this effort, we have developed a scope of work and a budget form that are particular to this opportunity. So again, if you have contracted for either workforce or stabilization dollars, you're already aware that we have particular budget forms for each initiative. And I just want to make sure that folks have this web page, this web page bookmarked and starred as a favorite. So right now I am on, I'm trying to make this go away so you guys can see, but the OASAS SAPT Supplemental Block Grant and Federal Medical Assistance Percentage Opportunities. Know that this is where we're listing information on our SAPT funded opportunities for providers. We are adding to this list as initiatives are being rolled out, and you'll see that we do have a quick link here to the medication delivery system. And if you click on that heading, you'll then have access to attachment B instructions. So these are the instructions that you'll follow in completing your budget form. We have a specific budget form for this project that's available here under contract and funding summary. We also have the scope of work and the funding declination form. So I'm going to start actually with the scope of work, and it's important that everyone read through the scope to understand, and I know Celine will talk a little bit more about what the expectation is and what the scope of work entails, but know that we have we've provided you with a scope of work. This will be part of the contract agreement that is included in your final executed contract. And there are some specifics in here that pertain to the budget, allowable use of funds, and some of the limits on the funding. So it's really important that you go over the scope of work and understand what you're agreeing to in accepting these dollars. A couple of things I just want to mention. that administrative costs are allowable up to 10%. Quick reminder that administrative costs are calculated on personal, fringe, and other than personal services. And that makes me want to jump to, if you don't mind my jumping, to the budget form. So again, we have a specific budget form for the OTP medication delivery service. This is what you will need to complete and submit by the 17th. So noted on the email that was sent out on Friday, we asked that providers please send us your completed budget summary form by January 17th, which is actually next Monday. We did make this a fillable form, so hopefully for ease of use, you'll be able to just click through this form. You'll see on the first page we're asking for the line items for personal services, fringe, other than personal, equipment, property, and agency administration. Note that we do need to have the form signed. And as I move to, okay, so actually that's all I have there for the form. That's correct, Celine, right? We don't have a page 2. Okay, I just made myself nervous there because I'm so used to seeing a budget detail for these projects. So this is the form that we're asking that you complete and submit by next Monday. Know that the total funds requested cannot exceed the maximum amount that was detailed in your in their email notification. And again, that form can be submitted directly to the COVID funds mailbox, which is listed at the bottom of that budget form. Last thing I want to comment on, know that if you choose not to accept the funding, there is a funding declination form that we ask that you complete. Also a fillable form. It's very brief, but we do ask for information on why you're declining the funding and also how you're managing a medication delivery system currently and ongoingly if you're not going to access the dollars. So fairly straightforward contracting steps here in terms of you submitting that budget form to the COVID funds mailbox by close of business next Monday, the 17th. We will then work to amend, hopefully, an existing contract to add dollars to the contract amount. And as with the other initiatives under SAPT, you are eligible for a 25% advance on the total award amount, which we will issue once we have the amended contract executed. I feel like that was a lot, but always know that you can go to the SAPT Supplemental Funding webpage, which I am going to put the address for that in the chat. So again, everyone should have that saved in their favorites, says me. But you want to have that link to the SAPT page, and then also know you can always send questions to the COVID funds mailbox. And I'm also going to put that address in the chat. So you have those two resources that are your go-to resources for all things SAPT Supplemental. Karen, did I cover it?
Sorry, I'm going to press all my unmute buttons. Yes, you did a great job again.
Thanks. All right, so Celine, we're happy to answer questions if when it comes to Q&A, folks have any questions on contracting, but I will pass it back to you regarding program expectations.
Thank you. Thank you so much, Connie.
I'm sorry, before we go back, Connie, I have a question, and this could help you and help the providers. When they choose to send their contracts back, should they be putting the name of their agency on the subject line?
Woo, woo, Leslie, you get points for that one. Yes, thank you so much. Thank you, thank you, thank you. When you submit your budget to the COVID funds mailbox, please include your 5-digit OASAS provider number and OTP medication delivery service in the subject line. And actually the mailbox address and that request is included in the email that you received, but thank you for that super important reminder, because we do have multiple initiatives and multiple providers sending us information to that COVID funds mailbox. So that will help us expedite the management of your submission. Thank you, thank you.
You're welcome, yay.
All right, yeah, that was super helpful. I think, managing so many projects at the same time, we need to be a little organized here. Okay, so I'm going to go ahead and share my screen in terms of talking about the actual program details and actual scope of work, just going over some nitty-gritty. Again, like Connie mentioned, a lot of this information, if not all of the information, is also on the scope of work. So be sure to really thoroughly read the scope of work that's posted on the webpage. So in terms of the program details, the funds can be used for basically making delivery services available to patients who are in need. I do have to point out that the delivery service should always be a last case scenario. Should always try and get other methods put in place, such as having a designated other pick up the medication on behalf of the patient if they cannot go to clinic, or coordinate for a transportation service for the patient to be able to be transported to your clinic to pick up medication. So delivery should always be a last case scenario. Always try and explore the other options before accessing delivery. So only OASAS approved medication for SUD can be delivered. So that being said, methadone can be delivered, buprenorphine can also be delivered if that is something that your clinic provides. The deliveries are to be coordinated and to be made by the OTP. So this is slightly different from the New York City MDS service that we've been doing this past year. If you are involved or have had experience with that, so that is a slightly different design. So in terms of this new initiative, your OTP is to coordinate and make the delivery to your own patients and guest patient, which I will talk about at the end of this slide. There are no restrictions in terms of where you're going to be delivering the medication to. It could be to a private residence, a patient's home, it could be a congregate care setting, etc. And patient eligibility must initially and continuously assessed, and that must be assessed by a healthcare professional. And I will talk a little bit more about patient eligibility later on, but just briefly, patient eligibility is basically whatever you decide to be your OTP based on your patient population. We're very flexible with that. So other OTP services must also continue to be available to patients, even if they are eligible and continue to be eligible for a delivery service long term. Guest medication are allowed and guest delivery are allowed, and they are encouraged as well. So you can make delivery to your own patient. You can also make delivery to a guest patient. So in terms of allowable and non-allowable activities, again, this is on the scope of work, but just to go through it. So in terms of allowable activities, supplementation of staff wages. So staff wages can be supplemented for the purpose of making deliveries to patients. That includes overtime. Mileage reimbursement of the vehicle, paying for tolls, paying for parking. If your OTP does not have a vehicle, which we are aware that a lot of OTPs do not, leasing a vehicle, and as Connie mentioned as well, administration costs up to 10% is also allowed. These are the non-allowable activities. So leasing a vehicle is allowed, but purchasing a vehicle is not. Any costs associated with the maintenance or insurance of the vehicle is not. You cannot transport patients. This is not for medication reimbursement, and funds cannot be provided to patients directly. So in terms of scope of work, this is the nitty-gritty and what you need to basically do to get this rolling. So first and foremost, some policies and procedures. So this list is not exhaustive, but these are just to get you started. So first of all, a medication delivery service workflow. So this is basically your standard operating procedure in terms of making deliveries. What is the flow? How do you assess and what needs to be done prior to making the delivery, during the delivery, and after the delivery? and then a patient or approved recipient verification process at point of delivery. So just to clarify, an approved recipient is someone that your OTP has vetted for that's able to accept the delivery on behalf of the patient for whatever reason. Let's say your patient is bedbound and not able to accept the delivery at the doorstep. So an approved recipient will be somebody that's able to accept it on behalf of the patient. So you need to have some kind of a process to verify the patient or the approved recipient. That could be checking ID, that could be providing them with a password beforehand, that could be, you can get creative with that, but you need to have some kind of process to know for a fact that whoever that's making the delivery hands it to the right person. Next, you need to have a medication delivery service patient treatment compliance monitoring procedure. This is a mouthful. What this really is that for patients who are receiving deliveries, how are you going to monitor that they are continuing to take the medication as intended, continue to monitor them in terms of their treatment. So you need to have a procedure for that, preventing diversion and all of that. Undelivered medication policy. So this is for whatever reason, let's say the medication has left the door of the OTP, got to the delivery location or even midway, and finds out that the medication cannot be delivered, you need to have a policy put in place as to what to do with the medication if that should happen. Empty bottle monitoring and retrieval workflows. So this is to basically have some kind of workflow, some kind of process to retrieve all those empty bottles after the delivery has been made. How are you going to monitor them, and how is that going to come back to the OTP? This is for short-term patients who may only have a one-off delivery, or a long-term, someone who has to deliver for a long period of time. Patient consent. So you need to have some kind of procedure to get patient consent to receive the medication through a delivery. Patient eligibility. So your OTP needs to be very clear in defining what the patient eligibilities are, what different criteria they may be. So that is flexible. We're not determining that on behalf of the OTPs. It is up to your discretion and up to your patient population. So as an example, you can have a COVID positive diagnosis as one of your eligibility criteria. Again, this is not limited to COVID only, but that is just an example. However, patient time and treatment is not an eligibility criteria that cannot preclude a patient from accessing the delivery service. So again, this list is not exhaustive. Any other policies or procedures that you think are necessary in terms of making the delivery service effective. Next, record keeping. So record keeping is really important. Record keeping as to who received a medication for what reason, etc., but also a chain of custody, knowing and tracking where the medication came from, who is handed to, etc. So that is subject to audit as well. So next, in terms of the actual execution of delivery. So deliveries are to be made using a private vehicle or other means, and they must be completed by an OTP staff person. If you are making a delivery not using a private vehicle, maybe walking, if let's say the delivery location is literally down the road, maybe, then prior approval must be obtained from OASAS before the delivery gets put in place. If it is being made with a private vehicle, then you don't need to obtain prior approval from OASAS. If the medication delivery is being made by an OTP employee at the executive level, so for example, a program administrator, assistant manager, a manager, or a medical staff, then the delivery team only needs to be one staff person. However, if your delivery is being executed by OTP employees that are not of the executive level, then a team of at least 2 staff members need to be available in making that delivery. And all deliveries must be made in appropriate locking containers. Next is patient consent. We highly recommend that you establish a standardized patient consent form so that you know that you have patient consent to accept delivery of a medication, and patient consent must be kept in the patient's file. Again, so in terms of patient eligibility, again, I'm talking about this over and over again. This is very important. You need to clearly define what those criteria are for your OTP and your patient population. You need to inform all OTP staff so they know that whether or not they can assess the patient and know that whether or not the patient is eligible for a delivery. Patients should also be informed in terms of these eligibility criteria. They need to be assessed by a healthcare professional and continuously assessed if the patient is on long-term delivery. Deliveries, again, is a last case scenario, right? You need to try and establish other methods first, whether that is a designated other, whether that is transportation services. You have to try all those avenues before utilizing the delivery service. Next, in terms of reporting, so we do ask that quarterly reports be submitted and details of and tally of the delivery service is submitted to OASAS using a standardized form. I believe the form, it looks slightly different from this, just formatting, but the content is similar. The form should be at the bottom of the scope of work that's posted on the web page as well. So use the form to submit quarterly reports to let us know how many deliveries were made and what is the reason for making that delivery to that patient. So that is where your patient eligibility criteria really comes into play. For example, like here, reasons for requiring delivery service, patients isolating due to confirmed COVID-19 case. So yeah, so this needs to be submitted quarterly, and that is the reporting that we are asking for this initiative. That is everything I have in terms of content and presentation. I guess now I'm opening time up for, before I go there, Leslie, Belinda, anything that I have missed, anything you want to add?
Nothing you've missed, nothing that I need to add right now, so.
Right. I concur. I just, I want to thank you, Celine, for a marvelous, comprehensive presentation. And again, we're going to be opening the chat box for your questions, and we will be getting back to you. So I'll turn it back to Celine now.
Thank you. So Jason will help us with monitoring the chat. If you have any questions, again, feel free to pop it on the chat. We will be developing an FAQ document after this webinar where we compile all your questions and provide answers to. So that's why it's so important to pop it on the chats.
So we have one question, and the second popped in. Will the program's policies and procedures for the new delivery service be reviewed to ensure compliance with DEA and SAMHSA regulations prior to implementation?
I would say what happens is that it's following what has been going on since OTPs with deliveries, especially during the pandemic. This is nothing really new. Linda, do you have anything to add?
No, I don't have anything to add. The expectation is that what your policies and procedures determine is fully in compliance with anything that has to do with DEA or SAMHSA or our own regulations. But it would, of course, be available to OASAS, and we'd want to have that information. We don't want to, have that accessible. Celine, am I missing anything, or Leslie, in regards to that response?
No, yeah, nothing. I think you covered everything.
Okay. Yeah. So I mean, the idea is that you are fully able to land on what your official policies and protocols will be in regards to, the delivering of medication, but it is your responsibility to ensure you are in compliance. So, and as an OTP, obviously, you probably know that better than anybody, the importance of that.
The next question, it seems that only the budget form must be submitted by 1/17. Is that correct?
That is true.
Nothing else so far.
We have a quiet group today.
That may mean that we were that thorough.
Celine and Connie, and if I might just, I don't know, I joined a little late. There was a little fire to put out earlier before I joined the webinar. But when it comes to, if this was mentioned, when it comes to whom these notifications were sent, and Connie, correct me if I'm wrong, these were sent to who's on our provider data system, our PDS. Is that right? So in our last seminar, what I urged everyone else who might not be the lead person on the PDS is please follow up with that person who's on your PDS to ensure that they've gotten the email so that it's seamless and so that by the 17th, this is all taken care of, because you would not want to miss the opportunity because it's not been, coordinated at your levels.
Mm-hmm. No, thanks, Leslie. That's a really good point. So the email was sent to the CEO, whoever's listed as the CEO for the provider in the provider directory system. So if you don't know who that is, you should check the PDS to see who you have listed. And two, if in fact there's been a change or that information isn't correct, two steps. One, please make sure that you update that information in the provider directory system so we can have a way to communicate with each of you. And then the other thing is to also then reach out to the COVID funds mailbox to say that you did not receive the email notification regarding dollars available for medication delivery system. Can someone please follow up and resend the email with the contact information? Also know that initially we did offer, if providers wanted to designate a specific contact for SAPT supplemental funding communication, they could do that. So if your organization did that, then it would be that alternate that the email went to. So track it down within your provider agency, and after having done that, if you come up empty-handed, please feel free to email the COVID funds mailbox.
And also, if I could piggyback, that was why we also sent out, obviously this webinar, but just the basic information to our OTP listserv. So many of you on the call, it's about you also shepherding this process. So we wanted to make sure that multiple levels within the OTP are aware of this funding opportunity, aware of the importance and the time frames associated with it. So that's why we wanted to make sure we cast a wide net, if you will.
Right. So another question came in. Are there any restrictions or guidance regarding which staff members, titles, credentials, and or how many staff are needed to deliver the medication?
I'm going to take a stab at this one. So in terms of, if let's say you have an executive level staff member, so a program director, an assistant manager, a clinical supervisor, or a medical staff, then you only need one of that person to make that delivery. If they are outside of that executive level or medical staff, then it will be staff that you have vetted, your OTP have vetted and trust this staff member, and in that case you will need two people to make that delivery. Am I missing anything, Belinda, Leslie?
Nope. Perfect.
Got it.
Okay, another question. Can we provide the federal COVID guidance and New York City workflows as a resource for OTPs as they write policies and procedures?
Can I just ask a clarifying question? When you say, can we provide, I guess I'm trying to understand the we. You mean whether or not one can use that in developing your policies and procedures? If that's the question, then most certainly, the thinking around, what resources would help you in developing your policies and procedures. You should be looking at all of that as, your guide potentially in determining eligibility, those sort of aspects. It's specific to your OTP as to what your eligibility criteria would look like. But yes, you can use any resource.
So the question I think is asking, can we send it out? And we as in us, OASAS.
Okay.
Gotcha. Okay, got it.
Yes.
Yes.
Okay.
We
Yeah,
can
we
provide that.
I will have to just jump right in and say, in terms of the New York City workflows, New York City the Department of Health have created a ton of information and a ton of documentation to describe how the city system flows and works. I will have to say, I will check in with them to see if that is something that we can make publicly available before sending it out.
All right, so how can
Good
we,
question.
as in the provider, not as in OASAS, how can we comply with this mandate if staff are reluctant due to safety reasons? They will grieve this to their union.
Well, I think the funding assures, that if there are staff that might be reluctant, I mean, if there's somebody else that needs to help with the delivery, it would pay in a dire circumstance, somebody else to go and take care of it, that somebody that would be willing to do it with let's say it's a counselor and a social worker. You would send the two of them. Again, if it's a program executive or a medical person in your program, they could go by themselves. But I mean, there are some flexibilities there.
And if I may say, many programs, and I think this was already indicated, many programs are already doing this. So there are a number of OTPs that were doing it prior to the pandemic, and then certainly, unfortunately, because of the pandemic, one of the many responses that the OTP system had to do, one of them involved delivering medication. So it's not outside the realm of provider staff responsibilities to do this, but yeah, I think that's something you would have to work out within your own organization and identifying the person or persons that would be best suited to do this. But I think one aspect to really think about in delivering the message to the staff is, the importance of this being an extension of the care that you give. This is about ensuring continuity of treatment. And sometimes treatment can't be done within the confines of the brick and mortar OTP. We need to go outside of the OTP to deliver care. And if I can kind of create that, alignment too with a separate funding announcement, which has to do with mobile medication units, it's the same concept. If people can't come to us and there's real burdens and challenges, we need to go out. We need to go out in the community. So it's not completely unheard of, unusual, and shouldn't be that sort of unusual for staff to really think about how do we provide good quality care to the people that need it. And this is really a wonderful resource to be able to do that, and to be able to allow staff to be able to meet people where they are at, in this case, literally. So my little, pitch and, have my little pom-poms in my hands as I say this, but that would be the way I would kind of try to frame it, in that how meaningful it is really to the care that you're already providing.
Wonderfully said. Thank you, Belinda.
No questions have come up.
I think I have one that's sent to me privately. So I'm just going to read it out loud. For the COVID positive patients, will you need a PCR confirmed test, or will a rapid home test be acceptable?
Do you mean, okay, at point of delivery? or would you, I guess I'm wondering if that infers, would we not deliver to
That's
somebody who's
eligibility. You have
COVID positive? I'm not sure I understand. And Belinda, I think you were saying something too, but can you repeat what you said? I think her video is messed up.
I think Belinda's losing connection.
Yeah.
Yeah. Hello? Can you hear me?
Yep. Yes.
Okay, I couldn't hear anything.
So I'm just going to repeat the question. For the COVID positive patient, will you need a PSR confirmed test, or will a rapid home test be acceptable?
I'm sorry, but I didn't. I want to make sure. So it's about regarding testing and what type of testing would be allowable in order to determine eligibility. So sorry, yeah, I thought I heard that. I said it, but nobody heard me. So essentially, it's your determination in regards to what you determine as eligible criteria. So that's your own policy and procedure in regards to patient eligibility. So that's something that you determine and you make a decision on. Celine, Leslie, I don't know if there's anything you want to add to what I said or a difference.
No, I would just add that, it's like Belinda, like you were saying earlier, the continuity of care, the ascertaining and ensuring that persons on this life-saving medication continue to get their medication. And, again, that's up to you and your program's policies and procedures, but it would be, it just would be wise to ensure the continuity of their care.
Yeah, I just wanted to clarify in terms of determining whether a patient is eligible and will get the delivery, that COVID positive test, what kind of test, we are not requiring that in terms of the delivery itself. Now, whether or not your OTP has other, policies and procedures that need to be put in place to determine that is outside of the delivery itself.
Mm-hmm. And actually, let me make also sure to say that it doesn't have to be only individuals that are either testing positive or are positive or have been exposed that can be eligible to receive medication for delivery. You can make varying determinations. It doesn't only have to be COVID. It's not specific to only that medical issue that an individual can get a delivery made. There could be a wide variety of reasons why the person cannot come into your program. The person can be in a nursing home. The person can be in some other medical facility or have other medical illnesses that preclude their ability from traveling to your program. So it's not only COVID.
Absolutely.
Nope, no more questions.
If anybody else has any other questions, we do still have a few minutes. Any other final responses then from anybody on the panel?
I think we covered a lot today. I think it's been a very great presentation, and you can always follow up on the COVID Funds website if you have questions regarding the process of contracting, etc., or just general questions. And don't forget to put your 5-digit provider ID number.
Just to say that we did a similar session last week. There were also different questions that have come up on that webinar. So we are working on compiling all those questions and developing an FAQ, which will be posted on the webpage as well. So maybe if you don't have any questions right now, but then might be worth checking other people's questions, because that might be helpful in your implementation as well.
Awesome, Celine.
Connie and Karen, any last words?
No, just, you know where your resources are. I appreciate Leslie reminding folks to include their OASAS provider number in any communication. And thank you for all the information to the rest of the group that you guys provided, and to our providers who are doing this work and implementing the delivery practice. Thanks, everybody.
Thank you, Connie and Karen and everybody today, especially our provider community. Thank you.
Thanks. Bye-bye, everybody.
All right,
Bye-bye,
thank you,
everybody.
everyone. Take care.
Bye.
Thank you, Celine, very much.